Hi guys, my name is Ubaid Mohammed and I work as a medical technologist at Glenox Hospital Laboratory. Today I'll be talking about purchasing and validating a new hematology analyzer. So the background for this is that we had a pretty old analyzer. The warranty for that analyzer was expired. So because of that, the technical support service was too expensive. Another problem was that we had to run samples manually on this old instrument one by one. So we had to take the cap off, run every single CBC or blood tube, whole blood tube, one by one, and then put the cap back on. And it was taking a lot of time. Another problem was that it was giving us too many positive results. Not that it would release the positive results, but we had to review slides for every single positive results to make sure if there is really something wrong, if suppose if there is really WBC count is high, or there is really RBC morphology found or not. So if we did not see any problem, then we would have to change the result and fix the result. So that's why we start planning to purchase a new hematology analyzer. First, we had to see our budget, if we have budget for a new instrument, and then if we have budget and time for training the techs, and then if we have enough manpower. So if one set of techs is uh, working, then another set of techs can be trained on the new instrument. Then we decided about the time frame for purchasing, for testing, for training, and then for to go live. Now we had to analyze what type of instrument do we want. We are not a very big hospital, so we decided not to purchase like a whole um, like a big instrument with the robotics included and the slide stain included. We just purchased like an instrument that would work for us. And I will show you a picture and give you more details about that. Uh, and then we also had to see not just um, what instrument is good for our hospital, like um, bed wise or hospital wise, but we also had to, of course, check our budget, our needs. So this is the hematology analyzer. It's a Sysmex XN2000. It can run around 200 samples per hour, um, and then it also gives exact count for most of the cells, of most of the analytes. For nucleated RBCs, our old instrument did not count the nucleated RBCs. It would just flag that there might be nucleated RBCs, but this XN2000, it counts the nucleated RBCs and gives us the result. Um, and of course, it's faster than the old instrument. And then so we had to design the lab, the department. We had to design the spot for this instrument. Then we had to test. We had to design so it can test the whole blood as well as body fluid. We had to have it connected to our laboratory information system and hospital information system. And of course, for that, uh, we for all these, we needed help from the vendors as well as from our information system staff. We had to design how it is going to verify the results, how is it going to auto verify the negative results and flag for the abnormal results, and then also the format of the results. How is it going to show the results to the nurses and physicians, and how is it going to show the results um, to the techs so they can work on the abnormal results. Okay, so this is how um, the results look like. This is for the text. So you can see on the right side is negative. The results are negative. All the counts are good. So it did not give us any flag. And on the left side you can see that's showing positive, and then you can see that it's asking us to make a smear and scan the slide, and then you can see why is it positive and what is it positive for. So you can see lymphocytosis, so lymphocytosis or blasts or abnormal lymphocytes. So it's telling us that the lymphocyte count is too high, and then there could be a blast present or abnormal lymphocyte present. So we have to review the slide to make sure all those things are um, right. So this is just like a basic workflow. We run the specimen in the hematology department on the Sysmex XN2000. It checks the data and decide if it's negative or positive. If it's negative, it will auto verify the result. If it's positive, it will ask us to review the slide. So now we have the instrument, we purchased the instrument. Now we have to validate the instrument. Validation is required by CLIA, which is a Clinical Laboratory Improvement Amendments, and it's run by FDA, CMS, and CDC. FDA, CMS, and CDC are responsible for CLIA. So we had to do it. And we also want to validate the instrument to validate the manufacturer's claims for their method performance characteristics under our current environmental conditions. For example, our temperature, our humidity, our water so we want to make sure that the instrument is performing as the manufacturers described it, that it will perform in our condition, in our environment. And we also want to make sure that the amount of error present in the system will not affect the interpretation of the test result and compromise patient care. So in the testing phase, we have three validation principles: installation qualification, operational qualification, and performance qualification. Installation qualification verifies that the equipment has been installed in accordance to manufacturer's specifications, and this is performed by the company's own field representative. Operation qualification provides evidence that the instrument operates as expected, and it is done by the field representative of the company as well as the lab technologist. And in performance qualification, we perform the method validation. We validate the method of the tests. We have four method validation process. We compare the method so we compare the methods between our new instrument and our old instrument to make sure that our new instrument is not giving us like very wrong results or erroneous results. And there is a whole like a method to do that. And then we also test for precision. So we want to make sure that that our results are repeatable on this new instrument. It's not giving us 4 WBC count on first result, and on the same specimen when we run again, it's going to give us like 10 WBC count. So we want to make sure that it's precise. And then we also validate for linearity to make sure that it runs the low levels of samples, analytes, as well as the high levels. And then we also validate it for the reference intervals, because reference intervals can be different for different population. So we want to validate the reference intervals for our population in our area. Reference intervals are the normal ranges for any analyte for CBC, for WBC count, the normal range for normal patient. Now we validated our instrument, we validated the method. Now we are going to train our staff. So we had to create some fake patients, so uh, we can run using those patients. We can use those patients as just regular patient and run the samples. We would run real samples like whole blood, um, but using a fake patient's ID. And then we will train the techs for how to read the results. And we also trained the techs for different running different kinds of fluids, different kinds of there's whole blood, then there is body fluids, spinal fluid, pleural fluid. um, and then we also trained the techs on how to run if the quantity is not very too much. If the sample comes with a low quantity, how to run that, how to perform maintenance, calibration, quality control, and if there is a problem, when and how we can call the technical support service. So after the training was done, um, we were in the evaluation phase. So now the instrument is live. We can start using it, and then it will give us result, and we can verify those results. So we want to make sure, we want to evaluate that the instrument is working fine, that the instrument is running smoothly. It's not giving us any questionable result. It's not giving us erroneous result. If we see a questionable result, um, we will evaluate the sample to see if there was any problem with the sample. Suppose the sample was drawn um, from the arm where there was a line, and then we got contamination in the sample. So we want to make sure that the erroneous result that we got from this instrument was not because of the instrument, but it was because of the sample itself. Then we also match the instrument's result with the slides that we review to make sure that if we see uh, 300 platelet, we are gonna um, do the estimate on the slide to make sure that okay, we are that's the result is right, and we are getting this much platelets. But this is just during the evaluation phase. If this is normal result, we will just auto verify it. We won't read the slide for all the normal results either. We will only read the slides for the abnormal results. Then we will make sure that the results are crossing over to the hospital information system. And then we also want to make sure that the technologists are comfortable running tests and reading results on the analyzers and reading results on the slides. So now we are on the maintenance phase. We do maintenance to ensure uninterrupted and quality service, to make sure testing is accurate and reliably available for patient care, and to prevent instrument failures and prolong life of the instrument. We have different maintenance. The routine maintenance of the hematology analyzers are calibration and quality control that we do every day, and we will not release any result until our calibration and quality control passes. Then we have daily maintenance that includes like cleaning the probes and some other stuff. We have as needed maintenance. Suppose there was a blood spill in the analyzer, so we had to clean it, so we will call it as needed maintenance. And there's some other maintenance included. Then we have weekly maintenance, bi-weekly maintenance, monthly maintenance, maintenance every 6 months, and then annual maintenance. So, finally, we are in the support phase. Support services is provided by the vendors. Laboratory technologists can call technical support service provided by the vendors for any issue that is not resolved by the routine maintenance. Support technicians, they can travel to customer sites to install, maintain, diagnose, and repair instrumentation. They also perform preventative maintenance and repairs. So I think that's about it. That's the usual process for um, purchasing, validating, and implementing a new instrument in laboratory. That's how usually it works. It was nice talking to you guys. Thank you so much for listening. Take care.